First off, I understand CMS recently released a report on improper payment data from 2024, and lab services were specifically identified as an area of concern. What were some of the errors they identified, and what will this finding mean for labs heading into next year?
Yeah, actually, Alex, it's interesting because when I reviewed the information, lab services were at the top of the list when it comes to improper payments being made. So some of the errors that they're finding, all of the errors that they're finding really revolve around the insufficient documentation from a clinical perspective, which puts labs in a difficult position because a lot of times they're a downstream provider and are just doing a service off of a requisition form or a test order. And so really tapping into those ordering providers' intent to order. They're seeing that the top error for labs is insufficient documentation around a provider's intent to order a specific service. And so again, a lot of labs say, well, we got the order and the requisition says, I want this test. The documentation behind that order really has to be sufficient as to why that test is being ordered and what the physician's intent is behind it. Supporting medical necessity is also one of the top reasons for insufficient documentation. And then on the lower end of the list of errors, but still tied into that sufficiency, they talk about the risk assessment that's needed for urine drug screens. So we see this a lot in when we do audits of labs, that the documentation, the clinical documentation, is lacking a written risk assessment to support the need for the urine drug screen. So we see that quite a bit in tox, and would really encourage all of our tox lab audience to take a look at their documentation, make sure that that's present, and then for all of our lab audience, really looking at those intent to orders and how robust the clinician's documentation is behind it. The OIG tends to look at outliers and aggregate claims data. And so when they start to see utilization or areas where they think that they may need to look into and recover some funds from the federal, from the federal funds. I don't know where those are coming from, but somewhere in the federal government there are funds. And so what the OIG does is they'll look at these outlier services and say, let's just take a really targeted look at the activity that's going on here. And so in this case, this is probably going to take about a year or so. I wouldn't expect this particular audit of Medicaid reimbursement to be done. The OIG says that they're not expected to have anything published until 2026. So this is over a long-term period of time. And when the OIG is auditing Medicaid payments, what they're doing is they're saying, hey, state Medicaid, this is the money that we have paid you from the federal government. Now prove to us that you should have been paid that much money. So the downstream effect in a lab environment can vary. It could be, now that the OIG has published this as on their work plan, all labs and payers in the industry are going to need to take note of it. And so this is going to prompt questions of one sort or another, just depending on what the payer's approach may be. So in this case, Medicaid, we may start seeing an uptick in Medicaid audits. Maybe they want to be proactive and look themselves to is Medicare going to request money from us back, and let's get ahead of this. They may not. They may wait until Medicare's findings are published in 2026. The OIG publishes their findings and they say, well, if there's a problem with this state, then we're going to go back and do an audit ourselves. If the federal government begins requesting state Medicaids to pay them back funds that they paid out for the Medicaid program, it's likely that those Medicaid plans are going to go back to our labs and say we want some of our money back as well. So to really get ahead of that, I would recommend working with a good external audit team, such as what we've got here at Lighthouse, to take a look at your documentation. Again, the documentation is really going to be important, because if that documentation didn't support payment and Medicare is looking at Medicaid and Medicaid's looking at us, that there's going to be some recoupments and clawbacks.